so?
Yeah, I wouldn't.
Maybe on the seat. Maybe on the seat.
Take this, we can move this down. That's it. There you go. Here we go. We're good. Let's calm down.
Where are you guys sitting?
Okay. You ready, Ryan?
What's up, CP?
Okay, good. Ryan? You let me know.
Shut your phones off.
Good afternoon. I'm honored to be back my first full week here at City Hall. And I want to start off by thanking all Patersonians, all people who prayed for me and my family, who sent outpourings of support and sympathy. It strengthened us, and I'm proud to announce that not only have I recovered from COVID-19, but my wife has recovered from COVID-19 as well. And so there are many people who are recovering. I don't want people to lose sight of the fact that, yes, you can get infected, but yes, you will be able to recover by taking the right measures. Sadly, my family has lost my beloved Uncle John. And the Paterson family has lost a former councilman and the current councilwoman and former mayor's husband, Eddie Cotton. And our Paterson Police Department has lost an officer, Frank Scorpo. So at this time, I'm going to ask everyone in attendance to just have a moment of silence for Ed Cotton and Frank Scorpo. Thank you very much, and may all those who have lost their lives because of this vicious virus rest in eternal peace. So, I want to talk about pandemic preparedness and how Paterson has been ready. About a year ago, our public health officer, Dr. Paul Prasad, approached me about a grant opportunity to strengthen our communicable disease investigative team. And I signed off. And last November, we made the announcement that Paterson was awarded $95,000 to build capacity, strengthen that communicable disease investigative team that we call the strike team. That strike team today, part and parcel of that grant that we received last year, is doing contact tracing so that we could slow the spread of this rapidly transmitted virus. Thank you, Dr. Paul. Also on the fire side with Brian McDermott, our chief. He had the foresight to purchase a prodigious amount of personal protection equipment, anticipating that this outbreak would be severe. And not only did Fire Chief McDermott purchase that equipment, but he has decontamination areas as well to clean that equipment for our fire department. So that I give you credit for, Fire Chief. And the fact that you did buy such an abundant supply that we were able to donate N95 masks, gloves, isolation gowns to St. Joe's, and we've made it a point, Director Castillo-Cruz, to deliver masks and gloves to our senior citizens. That's what proper planning looks like. Paterson's been prepared with the pandemic awareness. March 1st is the first confirmed case of COVID-19 in New Jersey. March 2nd, our business administrator had a meeting and was preparing a transition plan for employees to work from home. On March 13th, I issued my first executive order. And what it stated was we were going to limit the hours of operation here at City Hall to limit the exposure of the public and the employees here in the building and in other buildings here in the city. A few days later, on March 16th, I issued a very stringent executive order. What that did was essentially close down all non-essential businesses. And our executive order, which was followed by the state's executive order, included liquor stores, barber shops, and hair salons, which the state later included in theirs. What we had in ours, the liquor stores, which to this day, I believe, they are non-essential because they are antithetical to social distancing. Unfortunately, the state's executive order supersedes my executive order, and liquor stores were deemed essential, much to my chagrin. But I'll get to enforcement a little bit later. On March 16th, I also, in conjunction with the Office of Emergency Management, declared a state of emergency in the city of Paterson. And then a little over a week later, on March 25th, we closed all the parks in Paterson down. Now, in order to enforce these executive orders, under the leadership of Director Spezial and Chief Pecora, we created within the police department COVID compliance units. And we will see the statistics a little later as to the work that's been done to enforce executive orders. In late March, I asked our Chief Data Officer to provide us with a projection of what April 15th would look like in Paterson as far as the number of confirmed coronavirus cases are concerned. He projected in late March that by April 15th, Paterson would have 8,000 confirmed COVID-19 cases. Because of the action that we have taken, the social distancing measures that we have enforced, on April 15th, we didn't have 8,000 confirmed coronavirus cases. We had 2,500, so 2,500 confirmed cases. So a little over a quarter of what he projected. And this is to prove that social distancing does work, and the fact that we issue a stringent executive order and it's being enforced by public safety, that works as well. So we haven't stopped, even when I was in isolation. We started early, and we're going to continue to see that this virus is ultimately defeated. So at this time, I'm going to turn it over to our public health officer, Dr. Paul Prasad, for his presentation.
Thank you very much, Mayor.
No, he'll do it from there. You turn your mic on. Oh, you need the mics. They need these mics here.
You have to stand up one.
Yeah.
Thank you very much, Mayor. Just want you to look at this first slide on the screen. It gives you the big picture of what we basically do. A municipal health department is an arm of the state local health department. This gives you the big picture. We're not a hospital. We don't count ventilators. We stick to what we're tasked to do. Next slide. So, one of the big areas of epidemiology is infectious disease epidemiology. Now, infectious disease epidemiology is a very big area. COVID-19 is an infectious disease. So, we're tasked, as part of outbreak investigations, we're tasked with specific functions within that whole realm of investigations. So, local health department is tasked with investigating communicable diseases. We do epidemiological investigations of cases of communicable diseases. In the case of COVID-19, we do investigation of positive cases of COVID-19. These are very, very important concepts that needs to be grasped. So, what are some of these things that we do during this investigation? We do detailed interview and a now very famous word, contact tracing. Contact tracing is actually a part of the epidemiological investigation of cases. So we do detailed interviews, we walk patients through this infectious period, we determine who are the close contacts, we determine the isolation period and the quarantine period, and we determine close contacts based on that investigation. We locate and we monitor the contacts. We monitor cases also during the infectious period. And we reinforce public health prevention measures. In a nutshell, that is what we do. That is what we're doing during this outbreak of COVID-19 in That is what we're doing. That is our part in Paterson as the public health response to this pandemic. But this is very tedious work. It's very, very tedious. And I'm going to use a case example. I've tried to use a simple case. So the next slide, please. On the 21st of April, we are notified of 15 reported cases among the hundreds of cases we would have received. So I separated this. 15 reported cases on the 21st of April. Of those 15 cases, 11 were non-employees and 4 were employees. Of the 4 employees, 2 were Paterson residents, 2 were not Paterson residents. Not Paterson residents means it's not our case. It's not within our jurisdiction, okay? Of the non-employees, 2 expired. But they expired long before they became a case, maybe 1 or 2 weeks before they became a case. They're not our cases anymore because they expired. That leaves us with 9 non-employees. Of the 9 non-employees, 2 were sent home and 7 remained. Of the 2 that were sent home, 1 was not a Paterson resident, again, not a case, not one of our case. Although it's reported as our case, it's not our case. And the other one was a Paterson resident, that is our case. This is a textbook case of what happens when cases are reported. Why is a textbook case? 15 cases were reported, but by the end of this, when we did this is many hours of tedious work to investigate this number was reduced to 10 cases. You see how there can be mismatch in numbers? This is just one tiny example. Now, what are some of the factors that, next slide please, what are some of the factors that actually affect the accuracy of the data? And probably the integrity of the data. But what are some of these factors? And I'm going to mention some. There are a lot more. I don't know all of them. We use a surveillance system that is a statewide surveillance system. This surveillance system is not a Paterson surveillance system. We don't own the system. We contribute to the system. We input data into the system. But we do not report cases into the system. We do not do that. So we have our role, we have our lane where we have to stay in. So what are some of these factors that we have found that affect the accuracy of the data? And not only the accuracy of the data at our municipal level in Paterson. Throughout the state, throughout the length and breadth of the state of New Jersey, this is a common thing that's happening. Not specific to Paterson. Verified versus unverified data. The data that's entered into the system can be considered raw data. It was not verified. It comes down to the local health department to verify this data. And this is why we have to give a lot of credit to the state of New Jersey. Our state of New Jersey has public health done to local health departments at the municipal level. So we're tasked with taking care of what we have to do in Paterson. That's our jurisdiction. So another factor is different cutoff period. The state may cut off theirs at 8:30 in the morning. A county health department may do it at 11 a.m. We cut off our data at the end of our workday around 4:30 p.m. So different cutoff data time would account for some of the differences, little differences in data. Duplicate cases becoming very popular now. On Sunday, we reported initially 204 cases were reported to us. By the time we investigated that after numerous hours, it was reduced to 159 cases. Why? All duplicate cases. So we can't count one case twice. Then invalid test results. We get a lot of invalid test results. Maybe the test was not performed properly for whatever reason. I don't want to get into that, but the results are not invalid. And later you will see slides that depicting invalid test results. Negative test results. Negative results are also input into the system. We don't input that data. That's it. The data is inputted by all the labs throughout New Jersey, all the hospitals throughout New Jersey. We are notified. But when we look and when we investigate these cases one by one, we're getting negative test results. That's another factor. And then, last but not least, wrong jurisdiction and wrong addresses. So it's not unusual to find a Clifton case reported to Paterson. It's not unusual to find a Jersey City case reported as a Paterson case, and vice versa, of course. So these are some of the factors. Now, next slide, please. Here's an example of two lab results. I've taken off all identifying information from it. You'll see the top one says invalid. These are actually two cases that were given to us. One says invalid, the other one says SARS-CoV not detected. I'll give you why. If we're not careful what we do, when we see, if you run with this, that second one that says SARS-CoV, we can count that as a case, and we would have invested a few hours into a case like this only to realize we're dealing with a negative case, right? So we have to be very careful. We got to check the results very carefully. So that makes the work very tedious. So this is all tedious work. So there are two examples. Next slide, please. So there are a lot of, and I understand it, there are a lot of issues and questions with regards to numbers. I view numbers differently. We all view numbers differently. But I don't like to dwell on numbers because I have another term for that. But let's use the word numbers, for example. And I'm going to give you some very recent information. On the 23rd of April, we received 220, this is in the morning when we come to work, 220 unverified reported cases of COVID-19. After we went through some of the data, the preliminary scrutiny of the data, it was reduced back to 204. On the 24th, we received 209 unverified cases in the morning, and when we went through the preliminary investigations, we stayed at 209. That's okay, good. On the 25th, we received 190 cases of unverified reported cases, and after we did the preliminary investigation, it boiled down to 170 cases. That's minus 20. And on 26, I just mentioned it, we received 204 cases. 45 of those were duplicates, and we were left with 159 cases. This goes to show you why the numbers, as referred to as numbers, I do not use the word numbers. I use a more scientific data, but let's use the word numbers. This is what is a tiny example to show you why reported numbers by an agency is not. You cannot run with that. The numbers that actually matter, the numbers that actually matter, the numbers that actually matter. I repeated 3 times. That was deliberate. The numbers that actually matter are these numbers that our local health department are giving. Those numbers are the closest to the correct number. The closest to the correct numbers. And that's why I labeled that last column to the right as noise. That is what is creating the noise. That little difference in data. And this is a snapshot of 4 days to show you why there's noise and why we should not dwell on the noise. We should dwell on cases because we need to spend all our resources, Paterson. We need to spend all our resources, all our skills to go after our verified cases. That is where we're going to make the biggest impact, and that is where we're going to contribute actively to flattening the curve. Thank you very much.
And Dr. Paul, I also want to extend my gratitude to the contact tracing team. I know they're working around the clock, investigating cases, making sure that we isolated those who have been infected, quarantining the close contacts, and making sure that they're following up with these individuals that have been infected as well. Since we were on the subject of confirmed cases, we have numbers from over the weekend for the top 4 cities, the largest cities in New Jersey. So we'll start with Newark, which is the largest city in the state. And they had, as of Saturday, 4,999 confirmed cases with 343 deaths. Jersey City, which is second largest as far as population is concerned, had 4,637 confirmed cases with 272 deaths. Paterson, the third largest city in the state, had, as of Saturday, 4,168 confirmed cases and 130 deaths. And Elizabeth, which is fourth largest in the state, had 3,637 confirmed cases and 175 deaths. What does that show us? So based on population, your 4 largest cities have the largest numbers. In that order, of course. So it's a matter of density, because we're very densely populated, and let's be very frank, economic divide. Because there's a lot of people in Paterson, a lot of people in Newark, a lot of people in Jersey City and in Elizabeth. They have small homes. They have cramped up living conditions. They're living in close quarters. They may be sharing a bathroom, sharing bedrooms. So if you have a family of 8 living in that house, odds are, in that type of living condition, all 8 people are going to get infected. So that's how we explain some of these numbers and why they spread so fast in densely populated cities. So after this is all said and done, we need to address this issue so that we're properly prepared for the next pandemic as far as the density is concerned and the economic divide that exists and is playing out into the data. So if we want to drill down, look at the 4 largest cities, and you'll see those are where your numbers are. At this time, I want to call forward the Director of Health and Human Services, who's been doing yeoman's work within her department, particularly to focus on those who are most vulnerable to the scourge of the virus, and that is Director Oshin Castillo-Cruz.
Thank you, Mayor, and good afternoon to everyone. And before I start with our human services, I do think there's a note that's very important regarding the strike team, and I know it's been asked, the strike team is composed of members, 25 members. Now Dr. Paul has added additional members who currently work within the Division of Health. These are men and women that have been trained through the Louisiana State University as well as the state of New Jersey, and all had to pass a New Jersey administered test and score an 80 and above in order to be part of the strike team. Sorry, I'm short. So I just wanted to make sure that that's a very important piece as well as our trained professionals doing this job day in and day out. On March 4th, we had our first partners meeting, and this is why a lot of the things that have occurred in the city, we've been working with the police department, fire department, St. Joseph Hospital, Paterson Public Schools, and Passaic County, which is one of our greatest partners when we start talking about our homeless population. The Point and Count is a survey done yearly throughout the nation in order to count the unsheltered and individuals living in recovery center. In 2009, it was counted about 117 unsheltered individuals in the city of Paterson. That's without counting the hundreds of individuals that live in our recovery centers as well as supportive housing. For an example, Eva's Village has about 230 individuals living there, and Paterson YMCA has about 220. And these agencies also need our help. So this is part of helping the agencies maneuver with their residents and their patient and making sure that they're giving all the necessary tools to provide safe quarantine spaces, and as well as to possibly move some individuals out of those locations into other shelters in order to make sure that everyone stays healthy. The City of Paterson has partnered with the Passaic County Department of Health and Human Services, where they have partnered with an additional 5 hotels for our street homeless, for individuals who are homeless but may be living with a friend or a family member on a couch, and also for residents who can't safely quarantine in their house. Just as the mayor alluded to, we do have family members, large families that live in close quarters, and we want to be able to provide support for them as well. So if someone in that family becomes COVID positive, we're able to provide that person additional shelter in a hotel in order for them to not continue to spread the virus within their homes. So this is something that we're trying to support because of the density of the City of Paterson. The county has partnered with 5 hotels to provide shelter, as well as the recovery centers, shelters, and supportive housing as Eva's Village, Paterson YMCA, and St. Paul CDCs, to just name a few. The placement is very simple for our street homeless, our street population. The police department has done a phenomenal job in being our first responders and being that first call. If there's an unsheltered individual in the street of Paterson, we call the police department. They will then move over into calling New Jersey 211. NJ 211 will place the individual and open a case, and transportation will be provided to that person for safe transportation into that shelter location. Board of Social Services, once that case is open, it goes directly into Board of Social Services, and Board of Social Services then contacts the individual to assist them in other services. So we want to make sure that we're not only providing shelter, but that we are helping this person move on and move forward after the pandemic, and for them to get all the services that they need. Those who wish to call 211 directly themselves, there are some days where, quite honestly, there is a larger call volume and there is a wait. This is the first time that we are moving so many individuals and sheltering so many individuals, but there is a callback option. I think as you press 1, and you won't lose your space in the wait, and you can give you a call back. As of right now, we have placed 115 people. The county has placed 115 people, a vast majority of those individuals being Patersonians. So this is a process that it's working. It's definitely changing every day, but it's been an amazing partnership with New Jersey 211 and the Passaic County Department of Human Services. Over 115 people have been placed. So additional services have been provided for them, and then we're working on either getting them into a recovery center if needed, moving into permanent housing. So there's various options to make sure that after this pandemic is over, so after we move forward, that we don't leave these people behind and that we're giving them all the proper assistance needed. And moving into our senior services, who we know is our most vulnerable population, our senior services division has been doing a phenomenal job in partnering with United Way and the Food Bank of New Jersey to provide meals for over 1,400 seniors. And of course, that's not including our housing authority, who has been doing a phenomenal job as well in providing meals for the seniors. We have been providing non-perishable meals like rice, beans, pasta, cereal, and we're working to bring forward vegetables, fruits, and protein as well, just to make sure that they are staying safe and they are staying inside. The Department of Human Services also has been supporting, through a division of Ryan Wright, all of our individuals with HIV and AIDS, making sure that they have medical, housing, and mental health assistance and support, as well as our rent leveling, which our rent leveling coordinator has spoken to over 200 individuals in the city of Paterson, making sure that we provide them with the assistance in how to navigate through this crisis at this time. So the City of Paterson, you will see in our website the various resources that we are putting up regarding mental health, education, entertainment for your children as well as resources on food pantry, housing, financial assistance, family Medicaid, and Medicare as well. So we want to make sure that you have all of the resources, and our department is continuously open. Our phone numbers, our phones are still going, so you can contact our department for additional information. And in closing, and a very important part, is when we begin the conversation about testing. We have partnered, obviously, with Passaic County, where they have opened their testing site at William Paterson University. They have had 7,651 tests administered. Out of that, and this is, of course, as of yesterday's number, Monday, April 27th, out of the 7,651, 3,118 of them were Patersonians. St. Joseph also has an off-site testing site where they've administered 400 tests, and they hopefully will be expanding. 193 of those were Patersonian. And that's, of course, not counting all of our Patersonians who are attending their primary physicians, as well as going to the hospital through our EMS and fire, which I think the number is over about 1,900 calls that have been had regarding to transportation or people who are sick and are possibly symptomatic. And to continue to expand that conversation about testing and partnership, I know our housing director, Ms. Gorham, is going to talk about our next partnership with our seniors and what we will be doing in that regard. Thank you so much.
Thank you, Director. And I do want to draw your attention again to that slide about testing, what's happening at William Paterson University. 40% of those who have been tested, if we're going to put in a percentage, are Patersonians. The next city would be Clifton, and that's 16% of those that have been tested. So you can see a vast majority of people getting tested at William Paterson University are our people. And yesterday was a slow day. Typically Mondays are. They tested about 179 people at the William Paterson University site. Now, we'll talk about testing in a second, but Director, thank you for the work that you've done with seniors. Early on, one initiative was to reach out to supermarkets, and thank you, Dr. Paul, because you have a connection with them through the Mayor's Wellness Campaign. We reached out to supermarkets to provide exclusive shopping hours for senior citizens. And Golden Mango, Supermarket, Seatown, they all complied and said, we'll designate a certain time frame for these seniors and for their safety so that they can have exclusive shopping hours at their respective or their participating supermarkets. So we're proud of that. And then we are expanding on the program with the Community Food Bank of New Jersey and United Way, where originally it was about 1,100 seniors, now it's 1,400 seniors. And I believe, and the Director didn't mention this, but we've been working to secure funding from organizations such as the CDC Foundation and the Pandemic Relief Fund that was established by First Lady Tammy Murphy. So we are leaving no stone unturned as far as our seniors, their safety, and providing them with nourishment is concerned. So stay tuned, because in the future we will be making announcements. We're confident that the CDC Foundation will be supporting the city, and the Pandemic Relief Fund will be supporting the city as well for seniors and other members of our at-risk population, where we want to provide better capacity for Eva's Village, YMCA, and St. Paul CDC. I was proud to see yesterday a new initiative that we launched to help senior citizens so they don't have to leave their homes and put themselves in harm's way. We created what's called Neighbor Express. So senior citizens can stay home, order their groceries over the phone, and volunteers will go to the supermarkets, the participating supermarkets, and pick up those groceries for them. A lot of the seniors like ShopRite. We don't have a ShopRite in Paterson, but we want to accommodate their requests, whatever they desire. So ShopRite is one of the participants in Little Falls. We also have Golden Mango on board, Supermarket, and then Seatown Market Street will be participating as well. So you could see seniors are the focal point of what we're trying to do as far as safety is concerned, because our elderly are at risk. So we have to take care of the older adults that can't leave their homes, and we don't want them to leave their homes. If anything, the message about stay at home, it's directed towards them. Because when we slowly reopen our economy, I don't think they'll be able to get out anytime soon, Director Spezial. I highly doubt it, until we have therapeutics and then ultimately a vaccine. Now, we talked about seniors, we talked about testing. I'm glad that our Council President, Maritza Davila, is with us, and I'm glad that our 5th Ward Councilman, Luis Velez, is here, because we're making a major announcement right now. This is a partnership. Paterson is proud, and let me take this off, to partner with the Paterson Housing Authority. And so we are going to provide testing at 6 senior citizen sites in the city. Come on, let's go. Let's go. I want the round of applause. I know, standing ovation, please. Standing ovation, yes, please. Let's go. We've been working feverishly on getting testing, and the seniors are going to go first. And when I say first, that doesn't mean there's no one else that's going to follow as far as testing is concerned, because within coming days we should be announcing testing sites in the city. But keep that under your hat. Well, it's on News 12 and my Facebook Live, so it can't be. It's been disclosed. Yeah, so, and as you stated earlier, St. Joseph's Hospital does have a site. They've tested 400 people, and 193 are Patersonians. So there is testing taking place in the city. That's why you see your numbers go up as well. So our numbers are going to go up a little bit more because all 6 senior sites will be participating. So again, proud to announce, in partnership with the Paterson Housing Authority and our Executive Director, Irma Gorham, we will be providing free testing at 6 senior citizen sites. And this was as a result of what we did with the first responders, thanks Chief McDermott, where we tested all our first responders, DPW employees, and all other employees that believed that they were exposed as well. So at this time, I'm proud to announce, or I'm proud to call forward, our Executive Director of the Paterson Housing Authority, Irma Gorham, to elaborate on what's going to happen at the senior sites and the testing. And I think I can see Council President smiling through her mask.
I love you too. Good afternoon, everyone. The Housing Authority prides itself on providing clean, safe, and affordable housing to residents of the city of Paterson, especially our seniors. We understand that COVID-19 is a very serious illness that affects minorities and seniors at disproportionate rates. We want all of our residents to be safe during this global pandemic. To ensure safety, we are cleaning our buildings at least 3 times a day, with heavily trafficked areas being cleaned hourly or as needed. We are cleaning our buildings, one, to prevent the spread of this horrific disease. We're also checking on our residents daily by knocking on their doors or calling them. We're now moving to the next step in fighting for our residents' wellness. As the Executive Director of the Paterson Housing Authority, I am pleased to announce that the Housing Authority, with support from Mayor Andre Saya and the City of Paterson, will be bringing testing to our senior buildings. We believe that this testing will allow us to, 1, find the disease, 2, prevent the spread of the disease, and most importantly, let the seniors know that with this partnership that we really care about them and that they can stay in place and get the care that they need. We're working with the city on the final details, but we expect to begin testing the week of May 4th. We are asking residents to be on the lookout for flyers in the coming days for testing times. I thank you for your support, and let's get this going.
Thank you, Irma. We appreciate your leadership, and now we appreciate this significant partnership for our senior citizens. As we stated before, they're the most vulnerable to this virus, and we want to make sure that they don't succumb to the scourge of this disease. And so anything we could do to continue to be proactive in protecting our seniors, we will. We will take those measures. Speaking of measures and speaking of safety, we have with us our police chief, Mike Pecora, and for a presentation, we have our public safety director on enforcement. People are asking questions. Well, I see people loitering and lingering on the streets and congregating on corners. Well, the calls go in, and we specifically devised a unit, the compliance unit, the COVID compliance unit within our police department for enforcement of executive orders. And here in Paterson, we are data-driven. That's the order of the day now. We're becoming a 21st century city. And so it's been said, in God we trust, everyone else bring the data. So today we're bringing the data. Director Jerry Spezial, please.
Thank you, Mayor. Good afternoon, ladies and gentlemen. As the mayor said, enforcement is a major component of this. We recognize how serious this pandemic is, and this touches everyone. It does not discriminate. So as a result of this, we created a COVID enforcement unit, which has a sergeant and 4 cars. They run through different shifts. As we get towards the warmer weather, we are going to, this weekend, increase that, and we are going to double it. We are going to start at noon, and we will go all the way through into the early morning hours. We are going to make sure that social distancing, businesses that are not essential, this is about saving lives. That's what we are doing. If you look at the numbers, we have, since we started, over 477 violations, over 806 stops or warnings to make people stop. We have closed numerous businesses as a result of the executive order, and we have had 3 arrests, unfortunately, because it got where it was to the point where there was nothing more than we could do but then make an arrest. We are doing this in guidance with our Passaic County Prosecutor's Office. Our teams are out there. There's a supervisor, there's 4 units, and there will be an increase with the warm weather this weekend, which will go much longer. This is all about saving lives. We are committed with my partner, Chief Mike Bacora. We have and care about the people of Paterson, and we will continue to enforce this. Please stay home. Please close that business that's non-essential, because we will close it down. And please stay off of the corners from congregating, because otherwise we will go with the prosecutor's office, we will enforce the social distancing and the executive order. We are here to save your life. Thank you.
So again, just to point to the numbers, so total calls, I'm sorry, if we can go back to the previous slide, please. So since April 1st, when we implemented the COVID compliance units, 477 violations, and then warnings almost double, 806, business closures 12, and then we've had 3 arrests. So this is to prove that we're taking safety very seriously in this city, and that we are not going to allow anyone to violate what we've already implemented as far as executive orders, whether it's the governor's or my executive order as well. So thank you, Director Spezial. I mentioned him earlier. Our fire chief has been very proactive. He's been on the front line. I don't know what we would do without him, and he's helped in a number of ways, whether it's providing us with PPE for those who are less fortunate, or if it's planning testing at his site and now at the senior citizen sites. So at this time, gentlemen, I've affectionately dubbed America's Fire Chief, Brian McDermott.
All right. Thank you, Mayor. Thank you, everybody, for having me here today. So today I'm going to talk about 4 different points. Talk about response, preparation, community responsibility, and future preparation. So listen, it all starts with great leadership and a boss that lets you work. So thank you, Mayor, for having the faith in me to run this department. And under the leadership of my director, Director Jerry Spezial, I've been allowed to do what I'm supposed to do. And it works out great to have those that trust you. And I think I'm doing pretty good in not letting them down. So first, with our response. So Paterson was inundated with calls. At 8.4 square miles, we found in just over a month 5,366 emergency medical calls. That is an astounding amount. I know that our peak day was 180 calls in one day. That's a lot. Along with that, within that, we've faced 1,928 COVID response calls. Some have been very sad and tragic and resulted in fatalities. Some, I believe, have worked out a little bit better. But right now, we're on the decline. So whatever everybody is doing right now with their social distancing It's helping us to get lower on the backside of this curve. So keep it up. Keep up the social distancing. We've also responded to 209 hazardous materials calls for COVID. Generally, we'll do about 35 to 50 calls in a given year. We've done this in just about a month, 209 calls. That means that we're out there decontaminating our ambulances, decontaminating police cars, fire trucks, and making sure that buildings are safe. So we've done a lot as far as the hazardous materials response goes. In preparation is key. Paterson Fire Department is ahead of the curve in every single respect. We started our planning in mid-January for this, and our first note went out via Deputy Chief Matthew Hyman on January 24th in a CDC recommended level of protection against COVID for our first responders, and it continued daily from there. That was a big thing, us getting our people ready to respond immediately. So with that comes training hours. We've done 490 training hours in roughly a month and a half, 140 hours on PPE, 30 hours on decon process training, 60 hours on transmission and situational awareness alike, and a big number of 180 hours in refresher training, or basically policy revision. You know, CDC and working with St. Joe's and working with our professionals, we've had to do a lot of changes along the way for something that's brand new in COVID-19. So we've consistently kept our people informed. We've also done 20 hours of additional fit testing for those that we normally don't give out N95 masks to ensure that we're compliant with POSHA. Our community responsibility, you know, one of the things in the leadership with the mayor and the director here was making sure that we're out in the public and getting people to reduce the community spread. With Deputy Chief Cameron Gardner at the helm in OEM right now, we've given out 19,660 surgical masks. That's a staggering amount, and that shows that we were prepared prior to, because the next number is there's still 19,000 masks left. Aside from that, we've given out 4,421 N95 masks and made sure that our staff are fit tested. We've given out 28,300 pairs of surgical gloves, 200 surgical gowns that went directly to St. Joe's Hospital, 450 goggles and glasses to the police department and other workers that may need it, plus 371 to the Paterson Fire Department that's not listed, 500 plus individual hand sanitizers, and I thank the police department specifically for kicking us off with additional hand sanitizer that really helped out. 30 cases of Lysol. I know it says Kansas. 30 cases of Lysol were given out. And you'll see the 60 floor Zamboni uses. Some of the things we've done have been very unique. We have a floor Zamboni that's actually like a small floor cleaner that goes to every single firehouse to clean and ensure that the floors, that we're not tracking in the disease. So that goes around 24/7. It's going to the different firehouses. As well as one of the things not listed in here is we made our own mass decontamination unit that actually is made of a UV light and reflective steel that we're pretty proud of. So our community responsibility has been met and continues to be met on a daily basis. And now the future. You know, along with us being prepared prior to, we're still prepared to go into the future. We have 19,830 surgical masks left in our stock, 6,050 N95 masks, 405 pairs of eye protection, Lysol wipes, gallons of germicide, bleach, 28,000 more pairs of gloves, 843 Tyvek suits, 200 Tychem, thermometers, and Sandy wipes. So we've been prepared since day one. We're prepared to go into the future, and we're doing so with a great team here, and that's all I have from the fire department. So thank you very much to my leadership team, with the mayor, director, our deputy chief of OEM, Cameron Gardner, deputy chief of training, Louis Cruz, and our deputy chief of administration, Gabe Aboyan, and of course the men and women, the brave men and women who go in every single day, day in, day out, helping people from this virus. So please, I'd like to reiterate, keep your social distancing, stay home, use proper hygiene, and hopefully we can get on the backside of this curve very quickly and protect our people. Thank you.
You have a very sharp elbow, Chief. Thanks. Chief McDermott is proof positive, or should I say the personification of the following phrase: proper preparation prevents poor performance. That's right. A nod to you again. Thank you, Chief. We appreciate you. Lots of Patersonians are asking me, Mayor, when are we going to reopen our economy? There are a lot of small businesses that are suffering. We're not going to focus on a date. We're going to look at data, like what we've been looking at the entire time. And what is the data that we're looking at? We're looking at metrics. So if the chief's telling us that we're seeing a decline in calls for service of the ambulance, that's encouraging. If we see fewer people testing at William Paterson that are from Paterson, that's encouraging. If we continue to ramp up our testing to identify those who should be isolated and those who should be quarantined who have come into close contact with those who have been infected, that's a metric that we're monitoring. Because I know that our police chief is very cerebral and he likes statistics as well, so that's what's driving us as far as our decision-making is concerned. And I'm proud to say that Paterson has put COVID in a box, thanks to this contact tracing team. Because what we do is we identify who's infected, we isolate those individuals, interview them, and then as a result, ask for a list of close contacts and quarantine those close contacts and continue the contact tracing. And if we can scale up our testing capacity, then we will continue to put COVID in a box. That is what drives us every day to make sure that we can slow the spread of this virus in lieu of therapeutics, which are probably 3 to 6 months away, and Clorox is not a therapeutic, nor is Lysol. Hope that didn't go over your heads. And a vaccine is probably 12 to 18 months away. So what can we do now? That's exactly what we've been doing. COVID in a box, put it in that box. And as far as the economy is concerned, you saw Governor Murphy outline his 6-point plan yesterday, but did not give a date, because it's about the data. We have to start seeing things, even though with New York, we're seeing a positive trend occurring. Hospitalization rate is another metric that we're measuring, Council President. Got to look at all of these metrics so that they can guide, drive our decision-making process in Paterson. And so this is the way we view our economy here. We use the analogy of a faucet. We'll turn the faucet on carefully. And if, unfortunately, we see things start to erupt again, we're going to quickly turn that faucet back off so that there isn't a devastating next wave. But I don't want to discourage anyone, because I feel like what we need to do is support our small businesses now more than ever. And so with a detailed outline on what we're doing as far as economic development is concerned and the road to recovery, providing a blueprint for these small businesses to bounce back, is our Economic Development Director, Mike Powell.
Thanks, everyone. Thank you, team members. As I figure out how to derobe in this COVID moment, this is always fun. I do have a detailed list that I'd like to share with everybody equally. I'd like to send some love and affection to our Councilwoman, Ruby Cotton. I can't wait for the Ed Cotton barbecue this summer at some point in time. And I'd like to thank everybody for doing such a remarkable job. Everybody across the cabinet has been a true honor to serve. This city has gems that you can't imagine, and people have been stepping up to really fight the fight of a lifetime. And I think the things that we're learning during this pandemic will be part of a case study in public health and administration for decades to come. A couple things I just wanted to note, that what we're doing in terms of economic development in all the divisions is we're establishing uniform structure across all divisions and boards. We're holding weekly COVID calls with all division directors to report actions, challenges, as well as current relevant information. Establishing staggered staffing to minimize contact for the public, but we have to keep business going. We have to keep the affairs of the city continuing on, and that is our major focus. Implementing social distancing protocols in education, and that never stops, right? Because we can always do better social distancing. We can always learn better in terms of how it's going to appropriate and be appropriate for all the firms that are in this very diverse community that is the third largest city across the state. We're creating an appointment-only structure so that all the appropriate departments can continue to still serve people, but on a one-on-one basis so it can be timed out. And we're offering telework where appropriate across all boards, and establishing a series of outcome measures that I think are really going to be a great moment for us to be able to use a crisis to also guide future management and implementation. So calls, appointments, time, effort, protocols for non-essentials to meet and do other tasks. What I mean by this is we have a whole bunch of data that's analog here in the city. This is the perfect moment to begin digitizing all the different things that we have, like property cards and other things, so that we can, when we come out of this, and I know the mayor likes to use the faucet analogy, I'm beginning to think this is like a slingshot, right? That we're pulling back, we're stepping back, but we're building tension so that when we can come back, it'll be like David and Goliath, shooting a rock right into the head of COVID. So the other thing is that we're also enabling WebEx and remote, and I really have to give a shout out to Ryan Foote on our IT staff. He has been doing yeoman's work, really making sure that all of the boards continue to function. For me, that's the Planning Board, that's the Zoning Board of Adjustment, that's Historic Preservation Commission, and more importantly, it's also our City Council. Our City Council has done a remarkable job. This is not easy stuff, facilitating from afar, having complex discussions during a pandemic. I want to give a hat tip to Council President Maritza Davila, who's done a remarkable job, and also keeping us apprised of everything along the way. We're differentiating across also the essential and non-essential construction projects. This is a big element. I'm not going to go through all of these bullets. I know Brian McDermott might want me to, but I'm not going to do it right now. But I think we're also going to have this online. Most people already know it because it's been differentiated out by the governor. But it really kind of shows what we consider to be essential from the state's perspective, so that, again, we can keep the business of the city moving forward. Next slide. In terms of establishing information for the business community, the mayor immediately, I think it was actually March 19th, commanded that we create kind of a business action task force, if you will. And that's made up immediately of the Chamber of Commerce, our special improvement districts, which includes downtown as well as in Bunker Hill, Passaic County Economic Development, William Paterson University Small Business Development Center, our UEZ, as well as the NJEDA, the Economic Development Authority for the state. As a way to get information, share information. Everything that we have is on our city's website, which is important to also disseminate rapidly to the community because of where we are. Am I talking fast enough for everyone? We have a lot more slides to get there. We're also trying to hold different virtual information sessions. Part of the challenge that we have in this moment is the inability to get together. The inability to get sectors together or to be able to troubleshoot in different ways. So again, I want to thank the mayor for putting together our first webinar with Senator Menendez, Congressman Bill Pascrell, our entire New Jersey delegation for the 35th District, including State Senator Nellie Poe, Assemblywoman Shavonda Sumter, Assemblyman Benji Wimberly, and also members of Phil Murphy, Governor Murphy's staff, including Joseph Kelly from the governor's office, as well as Tim Sullivan from NJEDA. And what this did is it laid out the federal response to COVID, the state response to COVID, as well as what's happening regionally and locally in order to ensure that we're doing the very best. And more importantly, was to lay out the types of resources that are coming in terms of the CARES Act 1, 2, 3, and 4. I'm happy to report that we had over 250 businesses and entities participate on that webinar. I personally never run a webinar with that many people, but it was a great testament to the fact that we could get information out quickly, but it's also really challenging because it shows the level of pain and suffering that's out there. Now, in terms of data, as the mayor alluded to, this is also our moment to really combine databases in terms of the Chamber of Commerce, our special improvement districts, our UEZs, our mercantile, as well as the Hispanic Chamber of Commerce and the African American Chamber of Commerce, all of whom have come to the fold to be helpful to us during this crisis. So one of the things that we're also finding, and what I'll kind of introduce as we look to wind down my next hour of presentation, is that we're moving to modify and working with businesses to figure out how can they stay open by doing something different. So one of our companies, Yolan, that just recently moved here, they're making parachutes and other things. Now they moved into doing PPE and other types of things. Biogenesis down the street, they're doing all sorts of cosmetics. Now they're doing hand sanitizers and other things. So we're trying to help business stay in business, but also to be creative and innovative in terms of what else they can provide for the community. This is going to be a way for us to introduce stories of resiliency. I think there's lots of things that we're seeing on the front lines, and I welcome all those stories to come to our department and beyond so we can begin capturing it because there's some really important things that are happening out there in the community. So back to concluding here in terms of the road back. The governor yesterday laid out an ambitious plan for restoring economic health through public health, right? And there are a six-prong approach for doing this. Sustained reduction in new cases, expanding testing, robust tracing, not my word, securing safe places for isolation, responsible economic restart, which is what we're talking about now, as well as ensuring resiliency. So how does this all come together so that if this was to happen again, we're in pole position for the fall? And what we're doing now, and I look forward to working with others on this, is integrate the governor's plan locally. We already started this, right? prioritizing non-essential firms that were particularly hit was something that the mayor was out the gate very concerned about. Our barber shops, our restaurants, our beauty salons, and others. These folks had to shut their doors immediately. So we are working closely, Dr. Prasad and myself, the idea is to kind of select those specific categories and firms that are the most hit, like the ones I just mentioned, design strategic health measures and enforcement components so that they can go hand in hand so that when we can hit that restart button, we're ready to do it, so that we have clear rollout measures that are also dialed in and target those registered, particularly with the city in terms of UEZ, Mercantile, et cetera, because we have that relationship and we need to continue to build with it. Finally, a couple more things. We're also exploring through community development financial institutions other ways that we can fund or loans or provide loans for relief, recovery, and I think for restarting. And so a big part of what has actually happened as of 10:30 yesterday morning, the U.S. Small Business Administration reopened the Paycheck Protection Program as well as the Emergency Loan Program with forgiveness. So for those folks that are watching and listening, yesterday the website crashed. It was just too many people at one time. So just stay vigilant and continue to stay on it, and we're here to be helpful as you do. Other than that, we're also continuing to move along federal, state, and other types of grants and programs ahead because we have to show that there's hope. And a big part of being able to have the planning board, zoning board, and our other boards continue to meet and move the business of the city forward is it sends a message to the investment community, to the banking community, that things are leveling out. So while it's dire emergency on certain fronts, if you look at the markets, the financial institutions are still, they have plateaued and have been able to kind of hold on. So I think that this is a really important sign for us to continue moving on those land kind of important and catalytic projects that we've already teed up. And so again, I want to thank the mayor, I want to thank the cabinet, I want to thank our city council colleagues, because it's only in times like this that we have to come together to figure out how to really kind of make that slingshot work, because we got to take Goliath out. Thank you, Mayor.
I thought I was the only one that used analogies here at City Hall. But Michael, we also, I appreciate the slingshot. We just want to make sure it's not a boomerang effect that occurs. Look behind me. This is what leadership looks like. I appreciate what you're doing for our city, your dedication, your devotion, and your determination to make sure that we do bounce back as one Paterson. Thank you. Thank you. I give you a round of applause. Thank you, everyone. Thank you. And I also want to acknowledge those leaders that could not be here. They're essential to running this city. We have our business administrator, Kathleen Long. Thank you. Our corporation counsel, Farah Irving, is here. Thank you for being the leader that you are, Farah. I want to thank my chief of staff, Della Fisher, our public information officer, Jessica Diaz. Yes. Now, I spent 14 days in a basement. And you know me, I can't get rest. I'm restless. So I didn't stop. There were long days, 14 to 15 hours on the phone or my personal computer, leading calls, and also making timely decisions in a rapidly evolving situation. And what drove me to get out of that basement was the fact that I wanted to be here, where I belong. I wanted to be back where I belong, here at the helm, leading us on the front line as we wage war with a mysterious and serious virus. And as I've said in the past, it's an invisible enemy, but not an invincible enemy. So COVID-19, you will be conquered. There are plenty of people who serve as proof that this doesn't kill everyone, that there are many more people that are recovering every day. So every day we're going to give you brutal honesty, but we're also going to give you a dose of hope. That's right. And a dose of hope is that Paterson has a plan. Paterson has a plan for resilience and for recovery. And I'm proud to be here to lead us on that path, on that road to recovery. Thank you for joining us today.
Good job, guys.